Um, I realized a long time ago that our participatory democracy is a team sport, and I think all of us have a role to play on our team. Some people are good at organizing groups and work focusing on issues. There are other people who are good working through the mechanics of government. Any change that we want to make in policy or any way we want to make our community better ultimately comes down to writing ordinances at the local level, laws at the state and federal level, developing and passing budgets, and deciding the laws, the policies, the ordinances that make those changes happen, that make our government run. I'd been very active in the Durham community for a number of years, a lot of groups, organizing neighborhood associations, working in different civic groups. I was active in my church, and I worked around the mechanics of government. But I realized that ultimately I should be one of those people who were writing the laws and the ordinances and developing the budgets. And so I had the knowledge and the skills that would allow me to do, I thought that I'd be pretty good at it. So ultimately, I had the chance to run against an incumbent city council member who I didn't think was particularly effective. And I thought, gosh, I could do as good a job as that guy or hopefully better. So I ran for the city council, and what I found was that I actually enjoyed the work, but I began to see that I could make those positive changes that I was interested in and that could really help the people I represented. So that eventually led to me realizing that I could perhaps have an even greater impact, work on a wider range of issues if I went to the legislature. So that's when I first ran for the legislature, and found again that I enjoyed the work and really enjoyed helping the people in the 3 counties that comprise the 22nd Senate District. So that's why I'm running, is to continue to do that kind of good work for the people of the 22nd District. And frankly, if anybody's honest about it, they'll tell you they enjoy the work, because it's a lot of work. You don't get paid much to do it. And so I enjoy the work, but more importantly, I like the impact that I make.
All right. Well, thank you. Um, is there anything else that you want to talk about regarding like issues that you are running for?
Well, sure. I mean, there are a number of things that I think are very important for us. Education is at the top of my list of the issues that we're working on. So I want to continue to help build and frankly rebuild a strong education system from pre-K all the way through our university and community college system. That's an important issue to me. Healthcare is something that I knew about professionally, but had never really worked on a policy side until I went to the Senate these last 8 years. And now I'm very, very passionate about making sure that all North Carolinians have accessible and affordable health care, particularly in our rural counties where hospitals and clinics and private medical practices are struggling to stay open and continue to provide that care. Another thing that I feel very strongly about is having a strong economy that works for everybody in every part of the state. We're fortunate in Durham that for the most part, we still have a number of issues with our economy in our urban areas, and Durham's no exception. But for the most part, we have a fairly prosperous economy. When you go out to our smaller rural communities, you find that they struggle quite a bit to attract good jobs, to keep their economy going, and to rebuild. You see a lot of, particularly young people, say your age, who are finding it very hard to come back if they go off to college or they go to community college, they're finding it very hard to stay in the rural community they grew up in. So we need to turn that trend around and work very hard in our rural communities. So just building a strong economy in every part of the state and an economy that works for all people. So I would say those are the three issues that I care most about: education, healthcare, and the economy.